Hello, so today we're gonna do Linezolids. I am so sorry I took such a long break, did not upload for such a long time, but khair, I'm back and this is a very short video. So Linezolid is basically a bacteriostatic drug except in streptococci. Streptococci mein this is also bactericidal, okay? But in general you can remember this as bacteriostatic. This is a protein synthesis inhibitor in a way बिकॉज़ ये हमारे पास 50s और जो 30s सेगमेंट होता है एक राइबोसोम का उसको कंबाइन होके इट्स कॉल्ड 70s राइबोसोम राइट तो इट प्रिवेंट्स द बेसिकली द एडिशन और द arrangement of the 50 and 30s subunits into complete 70s subunit. So its mechanism of action is a bit unique. But in some books it says that it specifically inhibits 50s ribosomal जो subunit होता है because it messes up with its 23s ribosomal RNA of the 50s part. तो फिर इनकी assembly नहीं होती 70s नहीं बनता ठीक है तो this is like थोड़ी सी technical बात है. Its spectrum is this is unique and this is easy because this is basically used in all resistance gram positive bacteria ठीक है तो सबसे पहले and the most important one that you have to remember is linezolid is used for VRE or vancomycin resistant enterococci ठीक है enterococci में there's fecalis and faecium but in general just general बात है कि faecium जो होता है ये ज़रा ज़्यादा resistant होता है in general but you just have to remember it's used in vancomycin resistant enterococci of any sort can be faecium can be fecalis and these cause UTIs these cause biliary biliary infections these cause endocarditis and इसके अलावा this linezolid is also used for MRSA and VRSA or vancomycin resistant staph aureus even though linezolids are not preferred इसके लिए हम लोग streptogramins prefer करते हैं but anyways it's also used for listeria monocytogenes which is also gram positive and lastly it is also used in mycobacterium tuberculosis key resistant strains just if you remember linezolids just remember resistance ठीक है so it is used for UTIs by enterococci it's used for skin and soft tissue infections by staph aureus staphs pneumonia के लिए इस्तेमाल होता है again in enterococci and meningitis because of listeria just all of these things जो इन organisms की वजह से होती हैं ठीक है next its pharmacokinetics are super simple not that high yield this is orally or this can be given orally IV it has a large volume of distribution it is inactivated in the liver and then excreted in the feces or in the urine in inactive form तो ये हम लोग kidney failure में भी दे सकते हैं liver failure में भी दे सकते हैं you don't need to adjust doses तो it's a safe drug इस लिहाज से however when we come to its adverse effects so it mostly has GIT adverse effects जिसमें we have nausea diarrhea vomiting all of those things if you give it for more than 10 days this can lead to pancytopenia and particularly thrombocytopenia which is reduced platelet count ठीक है next important high yield adverse effect is serotonin syndrome होता है serotonin syndrome but this only happens if you give this in combination with an SSRI, if you're eating a lot of foods rich in tyrosine, if you're taking monoamine oxidase inhibitors, which I wrote it उल्टा यहाँ पे तो linezolid itself acts as a monoamine oxidase inhibitor right so it prevents the degradation of serotonin so if you complement it with more serotonin so that will lead to serotonin syndrome which basically means an increased level of serotonin उसका हम लोगों का एक triangle होता है या एक triad होता है of symptoms because of serotonin syndrome number 1 is altered mental status this includes anxiety can also include hallucinations but anxiety is very telltale secondly it involves ANS hyperactivity ANS hyperactivity में you include basically a sympathetic nervous system का अगर हम लोग इसको कर लें so that includes flushing because of vasodilation tachycardia hypertension vomiting and diarrhea mydriasis which is pupil dilation and diaphoresis or sweating these are just one of the symptoms of serotonin syndrome and the last symptom is tremors because of neuromuscular abnormalities जिसकी वजह से उनकी overactivity भी हो सकती है which causes tremors clonus hyperreflexia and can be like depression of neuromuscular activity which can cause like मसल रिजिडिटी, या फिर ऑल ऑफ दिस कैन जस्ट बी बेसिकली जस्ट abnormalities. इसमें हाइपर एक्टिविटी की क्या ही बात करें. एंड लास्टली इसका एक एडवर्स इफेक्ट है विच इफ़ यू गिव इट वेरी वेरी लॉन्ग टर्म, यानी मोर देन 28 days के लिए, तो दैट कैन लीड टू ऑप्टिक न्यूराइटिस एंड अदर न्यूरोपैथीज, एंड दैट कैन इवेंचुअली लीड टू blindness. So this is linezolid in a nutshell.